Well, it is Wellness Wednesday, and this morning we are diving into some surprising dental health truths and myths, because you know your dental hygiene is really tied to your overall health. It's so important. So we want to make sure that you have the knowledge you need to keep you and your family safe. Dr. Kris Alpers from Alpers Dentistry in Scottsdale is here to share what is actually helping and what could be harming your smile. First of all, I have to say, being in front of you, I'm like scared to, I don't even want to smile, because I feel like, does everyone think you're diagnosing like them? Like, she's got this, I can tell. Right. Or is that happen to you at like parties and stuff?
Sometimes, but you've got a beautiful smile. So, yeah.
Oh, thanks. He's like, I'll get to her later. All right, I want to start right now with whitening toothpaste, because so many people use this. They want to, show up at the office feeling their best here, and they think it really is helping. But what's actually happening when you use these kinds of products?
Yeah, great question. Everybody who doesn't want a whiter smile, so we're naturally going to gravitate towards that whitening toothpaste. But what's actually surprising is it's not always helping your teeth. It can actually harm them, because it usually comes with a really abrasive compound and isn't actually getting the result you want, which is brighter teeth, but can actually be damaging the enamel.
Wow. Okay, so we're running down kind of some of the myths that there are, or at least the truths, we should say, of how this could actually harm your teeth. It's not actually whitening them, is that right?
Not always. It can look like it's whitening, but it's actually just kind of an abrasive that can be kind of removing the finish or the shine of the teeth. So we typically don't recommend gravitating towards that whitening toothpaste.
Okay, so if you wanted to whiten your smile, would you say just go to the dentist and kind of do a professional one?
Typically a professional whitening. There's some over-the-counter products that can just, safely brighten and whiten your teeth.
Okay. All right, let's talk about mouthwash. Everybody wants that fresh breath when they're, saying hi in the morning, especially after you have that morning coffee, right? It's a staple in so many people's routines. What are your thoughts about mouthwashes? Are there some better than others? And some I see are like help your gums and they whiten your teeth as well. I didn't know that mouthwash could do so much.
Right. No, everybody is used to kind of wanting that minty fresh feeling. So I personally don't use mouthwash very often. A lot of them are packed with alcohol that can really dry out your mouth, can disrupt the healthy bacteria in your mouth. So if you do want to have that fresh feeling of that mouthwash, we recommend going with a natural one that's alcohol free. And then also try not to do it immediately after you brush your teeth, because a lot of times when we're brushing our teeth, the toothpaste we use have like a healthy compound that's left behind, whether it's fluoride or hydroxyapatite. And if you swish with mouthwash, you can actually kind of just wash that all away.
Get out. I thought that you were supposed to follow up your toothbrush, like it's the icing on the cake, like before either you go to bed or you get out the door in the morning. So then between flossing, brushing, rinsing with mouthwash, what's the order we should be doing this in?
Yeah, so typically we recommend that you floss first, and what you're doing there is you're kind of disrupting the bacteria or sometimes the food that gets stuck in places that's hard to reach. Then we recommend that you do brush your teeth. If you were to use mouthwash, sometimes it's just something you do in the middle of the day to freshen up, or even before all of that, but not to end with like a really harsh product that has like an alcohol or that stinging feeling.
Yeah, like you don't have to save it for the times that you brush. You can kind of do it throughout the day.
Right.
Wow, that's so interesting. So talking about trying to get that like fresh breath, your oral hygiene here going, I'm curious about the tongue. I've definitely seen like on TikTok or Instagram, right, everybody's tongue scraping. They're talking a lot more about your tongue health now. What do you recommend for, kind of keeping everything healthy in there?
Yeah, that's right. So your tongue can harbor some bacteria, and it can kind of lead to that feeling of things not feeling so fresh. So you don't always think to brush that, but we do recommend just brushing your tongue with a toothbrush. There are tongue scrapers that you can use, which help kind of clean that, and that will help kind of ultimately just keep everything nice, fresh, and healthy.
Okay, so when do we do that? In the order of things.
Yeah, so if you're gonna brush, usually I would do that at the beginning,
Really?
before that.
Okay, so you floss, you tongue scrape, then you brush, and then you can mouth rinse throughout the day.
Right.
Oh my goodness, okay. I want to talk about carbonated and those flavored waters. I do a lot of the flavored waters. I know Emma loves herself a fizzy Diet Coke, right? They're everywhere right now, all these carbonated drinks. Okay, so are they actually having any impact on our teeth? I know maybe some might have an impact on the health, but what about our teeth?
Yeah, no, we all love those drinks. So they can negatively impact your teeth if it's something that you're sipping on throughout the day. If you do have that here or there and you're not sipping on it all day long, you're usually okay. But They do have a little bit of acidity to them, so if you're
Yes.
sipping on anything acidic, whether it's a carbonated beverage, sweetened coffee, it can kind of break down and damage the enamel that you're trying to protect.
Oh no, I was looking at Emma like, oh my God, your teeth are gonna fall out like tomorrow. But then he said the coffee and I'm like, oh no, my teeth are gonna fall out tomorrow, uh-oh. Okay, so for somebody who does want a truly, you know, healthy smile, I mean, what simple changes would you recommend that we can start today?
Yeah, I would just say trying to brush 2 to 3 times a day. We recommend using an electric toothbrush. You can still use a manual toothbrush, but one little nuance with toothbrushes is try to use one that's soft or soft to medium. Don't gravitate towards one that's medium or hard because you can actually scrub a little bit too much. Then floss, you can use a water pick. Try to do that 2 to 3 times a day, and then do try to make your regular dental checkups because there are things that we're able to do and clean and make sure that we're staying on top of to keep you optimally healthy.
Yeah, I know the water pick, that's everywhere too. I mean, that's your preferred, would you say that's your preferred way for people to floss and kind of rinse everything out?
As a dentist, we tend to do both, but if you are not going to floss, a water pick is a great way to kind of flush and keep everything really healthy.
Yeah, just get all of that gunk out of there. All right, Dr. Kris Alpers, thank you so much for being here. We really appreciate it. And oh my gosh, Emma, I feel like I have to, you know, overhaul my entire brushing routine.
Yeah, I feel very targeted during that entire interview.
So do I. Like,
Yeah.
oh, look.